Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my boards exam, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about the causes of lower motor neuron lesions. Let's do a general overview and then go specific. This is an image you've probably seen before. You have the spinal cord, nerves go into it, nerves come out of it, and then there's communication to and from the muscle. We will zoom into this in a little bit so you can see the anatomy, but the purple line is a lower motor neuron. It's a nerve cell whose cell body is located at the anterior horn of the spinal cord, and its axon extends through a peripheral nerve to innervate skeletal muscle fibers. A lower motor neuron lesion is damage to any part of that nerve cell, so anywhere along that purple line, including the cell body. So what causes these lesions? Well, in order to talk about that, we have to break down the anatomy. Let's start from here. This is a superior to inferior view of the spinal cord. The lower motor neuron starts where that red circle is, at that anterior or ventral horn of the spinal cord. And the line that's coming out of it suggests the axon. But let's talk about the cell body. Any lesion or damage directly to the cell body or to the region of the anterior or ventral horn of the spinal cord will result in a lower motor neuron lesion. So, what can cause lesions to happen here? Infections might cause it. Conditions like poliomyelitis, they attack and destroy anterior horn cells. West Nile virus, if someone has that, it damages the anterior horn cell. Genetic disorders, if someone has spinal muscular atrophy, they have a hereditary disease that directly affects anterior horn cells. If a person has ALS, one of the places that ALS affects is the anterior horn cell. A physical trauma, if someone happens to hit the right spot, that exact spot of the cell body, they will result in having a lower motor neuron lesion. Compression, if a person has a tumor that's in the region and it's compressing that anterior horn, thus affecting the cell body so it doesn't work normally, there you go, lower motor neuron lesion. If a person has a herniated disc that's large enough to compress that area, same thing, lower motor neuron lesion. All of the conditions and diseases that I've mentioned so far, understand that they can definitely also affect other parts of the body. But the fact that they do affect the anterior horn region of the spinal cord, they do affect the cell body, this is why a person has a lower motor neuron lesion. It doesn't mean that they only have that. They can affect upper motor neurons as well, etc. In addition, the way that the lesion is made can vary, as you could tell. It could be a cut, it could be a stab wound, it could be due to inflammation, it could be compression. So it doesn't matter how that cell body is damaged, it just matters that it is damaged and it's not working the way that it should. Well, the only other place along a motor neuron that can be affected, causing a lower motor neuron lesion, is the axon. So let's talk about what conditions and situations might cause damage to the axon. Motor neuron diseases, people who have ALS, it affects axons. Having an autoimmune disease like Guillain-Barré, even though it affects the myelin sheaths, this is still affecting the axon, lower motor neuron lesion. Physical trauma, again, if someone happens to stab or make a lesion or laceration to an axon, it's going to result in a lower motor neuron lesion. Compression, nerve compression from a herniated disc. Think radiating symptoms down a person's leg, sciatica. Think about compression of the brachial plexus. Compression is going to result to damage in that lower motor neuron axon. That's a lower motor neuron lesion. A tumor formation, this can compress the nerve, not allowing it to function like it should, thus it is a lower motor neuron lesion. The last thing to note is that when that axon finally reaches the neuromuscular junction, just before it communicates to the muscle, if something were to happen in this area, this is not considered a lower motor neuron lesion. This is a neuromuscular junction disease or disorder. Something totally different, even though the signs and symptoms might have some similarities. They are different. So check out our video on neuromuscular junction disorders. If you enjoyed this thorough explanation, check out our courses at sptwithme.com when you're studying for the NPTE. Check out these references for more information.